Tommy Whitelaw. I'm the National Lead for Caring and Outreach at the Health and Social Care Alliance Scotland. And thanks to all for tuning in to this NHS Scotland Conference Alliance Live special. Today, we will be chatting with Scotland's Chief Nursing Officer, Deputy Chief Nursing Officer, the Chief Healthcare Science Officer, the Chief Allied Health Professions Officer, and the Chief Midwifery Officer. We will learn more about all of their roles, insights, and experiences over the course of our conversations today. But for now, I'm very pleased to be joined by Professor Alex McMahon, Scotland's Chief Nursing Officer. Hi, Alex. Welcome, and thank you for taking the time to join us. Please, can I start by asking how you're doing today?
Well, thank you, Tommy. I'm delighted to be here. I'm absolutely splendid today. Thank you for asking. And I'm really looking forward to doing this interview with you.
Thank you, Alex. But maybe we can start. Could you start by explaining to us a bit more about your role in Scottish Government as the Chief Nursing Officer? And what does that mean?
Okay, so the Chief Nursing Officer has a directorate within government, and that directorate sits within the Director of Health and Social Care. So as well as being the Chief Nursing Officer, which is a professional title, representing the tens of thousands of nurses who work in health and social care across Scotland. I also hold a post of director within the Scottish Government as well. So I kind of wear two hats from that point of view. And you've mentioned some of my colleagues that you're going to interview later on as well. They sit within my directorate. So my directorate has within it nursing, midwifery, allied healthcare professionals and healthcare scientists as well.
So that's a big directorate, isn't it? And lots to cover there, Alex. There, a big, yeah, absolutely.
It's a big directorate, but it's big in the sense of the policy areas that it's got responsibility for as well. Yeah, absolutely.
Oh, thanks. That's great, and helps us understand a bit more about where everything fits across Scotland. So we're at the NHS Scotland Conference in Aberdeen, Alex. Can you tell us how your nursing colleagues are engaging here during the event?
Well, it's great, first of all, to be in Aberdeen. It's obviously nice that we're all getting out and about and travelling around Scotland again, getting to meet colleagues that we haven't seen for quite some time. Sometimes you bump into people and it feels like it was only 2 minutes ago that you last saw them in person, but for some of us, it was actually a couple of years ago since we last saw each other in person. So there's a lot of catching up going on, which is nice. There's obviously a lot of activity in terms of participation in the events, and also the stands as well that we've got, and you'll get a lot of interaction on the stands as well. But a really positive vibe about being in Aberdeen and being at the event, and hopefully lots of networking going on as well.
Yeah, I've personally missed that networking over the last couple of years. It's really important, isn't it, to have those conversations and time to chat and catch up and engage and learn more. And that brings me on to the pandemic has been pretty challenging to health and social care over the last couple of years. What are the challenges and opportunities that lie ahead for nursing colleagues in Scotland, Alex?
Well, firstly, I would say, Tommy, it's been a really hard couple of years. It's over 2 years now since the pandemic started. What I've seen in nurses across Scotland and beyond has been just a massive commitment to come back to work every day to deal with the work that they need to do and support and give the best care they can to patients. So resilience has been incredibly high. It's still challenging at the moment. We're coming out of the pandemic, but we're also now facing other things in the current world that we're living in, with the inflation of food costs, cost of living costs as well, that affect people in different ways too. And that takes us into that social care element of how we support people at home as well. But the kind of positives are the teamwork, the innovation that's taken place, the use of digital means to interact with people in a way that we didn't before, which means that we can keep in touch with people better and sometimes more quickly as well. So there's been lots of that development that's gone on, but just genuinely an appetite to deliver and continue to deliver the best quality of care that we can.
Oh, thank you, Alex. And actually, can you tell me how will you be spending your time at the conference, Alex?
Well, I've got a few sessions that I'm doing, one of which is an audience with the Chief Medical Officer and the Chief Nursing Officer. So not quite sure how that will go, but I'm really interested in the questions that people will pose to Gregor Smith and myself. I'm also taking part in a discussion on the National Care Service as well. So that's a very topical topic, and so I'm looking forward to what the audience might have by way of questions on that. And I'm also looking forward to just going to some of the sessions myself, and also being on our stand. My directorate's got a stand at the conference, so if you come along to the stand, you'll actually get to meet some of the people that you're interviewing, and myself, and some of the other people who work with me in my directorate.
Oh, so they sound like a couple of great sessions, and there'll be lots of great sessions over the days at the conference. And there's a wee call out: come down to the stand and have a chat with the Chief Nursing Officer.
Please do that. Yes.
If I'm allowed to welcome people to do that, come and have a chat with the Chief Nursing Officer. Alex, what message would you like to give to colleagues listening to this interview and across Scotland?
Well, firstly, just to echo what I said earlier about, thanks to everyone who has done what they've done over the last couple of years. I came into government last October. Before that, I was Exec Nurse Director in NHS Lothian, so I very much had that front-facing role, and I understand completely what it was like for people working in health and social care. And actually, one of the things that I've done coming into government has made sure that I've kept up that visibility. So one of the things I've really cherished is going out, meeting people in the places that they work in, just to put myself in their shoes, as it were, and to understand what it's like. So that's something I'm going to continue to do. And again, if people want to come down to the stand and say, we'd like you to come and visit us, then please do that, because I'm always receptive to an invitation. So that offer is something I'd like to, but also just to say, in terms of the future, I think there's loads of positives building on what we've done over the last couple of years that we mustn't let go of. I think we do need to look after our well-being, our resilience. So one of the things I would say to people is, please make sure that you look after yourself in order that you can look after the patients that you care for too, from that point of view. And you will know the things that make you feel good, be that the hobbies, be that gardening, be that mindfulness, be that whatever it might be. So please make sure that you do look after yourself, because your health is just as equally important as it is to everyone else.
That's a really important message, Alex. So thank you for sharing that. So can I just give my great thanks for joining us today, Alex? And can I take a wee moment to thank you and all your colleagues for everything that you do every day? Thank you.
Thank you, Tommy. It was a pleasure.
As we continue our NHS Scotland Alliance Live special, I'd like to welcome our next guest, Catherine Ross, Scotland's Chief Healthcare Science Officer. Hi, Catherine, welcome, and thank you for taking time to join us today. Please, can I start by asking you how you are?
Tommy, I am fantastic today. I'm feeling much better, but really, really good to meet you and really good to have the opportunity to chat with you today. So how are you?
Yeah, I'm doing good. Yeah, and really looking forward to our conversation today. And for anyone listening, to visit Stand 60 at the NHS Scotland's conference, and you can meet the team in person as well. Catherine, please might I start by asking, can you explain to us a bit more about your role at the Scottish Government as the Chief Healthcare Science Officer, and what does this mean?
So thank you, Tommy, actually, because I'm really keen to tell you a little bit about more what I do and also what healthcare scientists do. So as Chief Healthcare Science Officer within Scottish Government, I have a number of sort of key roles. So policy development across all elements of impacted services by the scientific workforce within the NHS in Scotland. So that could be education, clinical services, workforce research. And really, obviously, a number of those activities require collaborative working with policy experts in government, as well as the other chief professional officers within government, really just as we work in a sort of clinical environment in that sort of multidisciplinary team approach. So services aren't sort of delivered in isolation, and sort of government policy isn't thankfully delivered in isolation either. So it's that sort of partnership working within government to develop policy for our patients and ensuring that patients and the public remain at the heart of what we do. But if you indulge me for a moment, I'll tell you a little bit about healthcare science, if that's okay. So healthcare science is really the collective name for over 50 different professions. So those can really be, I guess, described in 4 broad groups. So not in any particular order, because I don't want to prioritize anyone over anyone else, but if you think about our laboratory group, so that's anything from our biochemists, microbiologists, virologists, geneticists, and they're really our laboratory based scientific workforce. Then through to our physiological scientists, so they would be our more patient-facing scientists. And they work across lots and lots of different clinical areas, such as cardiology, respiratory, vascular, and even sort of critical care as well. Our next group is medical physics and clinical engineering. And then our 4th, and really our more emerging group within Scotland, is data scientists and bioinformaticians. So I think you're probably kind of getting the impression it's a large and also a very diverse workforce that I represent. Now, we work across the entire patient pathway. So whilst you maybe don't see us, we work every way through from prevention, diagnostics, rehabilitation, treatment, intervention, and we're actually responsible for just over 80% of all of the diagnostics done within health and social care. But I suppose as my sort of role, it's a real incredible privilege, if I can sort of say that, to be head of profession for the scientific workforce within the NHS in Scotland, to be one of 4 across the UK holding this role. I sort of considered it a real sort of personal privilege whenever I have such an incredible workforce to provide professional leadership for.
Well, thank you. Thank you for such a brilliant overview of such a wide portfolio and vast area of work. That's brilliant. Thank you for sharing that with myself and people who are listening today. So we're here at the NHS Scotland Conference in Aberdeen. Can you tell us about how your colleagues are engaging during the event?
So really, obviously, I'll be there, and I know there's a number of my scientific colleagues from across the NHS who'll be present at the event. And really, I guess, as we all work together to build the profile of the scientific workforce within the NHS, I'd like to see in the future more science, I guess, in the programme, but I'd like to see more science everywhere. So I'm always going to say that. But of course, because there's so many cross-cutting themes within the programme, there's research, there's innovation, there's hospital at home. And actually, of course, our scientific workforce are at the forefront of a number of those pieces. So I think it'll be a really great experience, sort of where our scientists can work collaboratively and see some of the excellent work happening in some of the other professional groups as well. But of course, I think it's going to be a very exciting event this year. And I'm sure you'll agree, as most of the people I've spoken to will agree, what an incredible programme that really showcases the diversity of the professions that we have working across health and social care in Scotland.
Yeah, I completely agree. And that opportunity to network and also out with the parts of the programme and the brilliant sessions on and different keynotes, that opportunity to connect again as well and share roles and ideas. So, Catherine, the pandemic has been pretty challenging to health and social care over the last couple of years. What are the challenges and the opportunities that lie ahead for healthcare specialists in Scotland?
So I think, Tommy, we'll all agree the pandemic has probably been amongst the worst experiences that many of us have ever encountered. The impact to lives, the ongoing health impacts, and also, of course, the backlog to services. It's going to probably take us quite a long time to really fully appreciate all of that. But I am so proud of our scientists. COVID has really shone a light on the science behind health. And I don't think ever before has the public or even our other professional colleagues had such an opportunity to understand the impact that a highly skilled scientific workforce has within the NHS. If I can share with you a few things that our scientists were doing during COVID, if that's okay. And really, obviously, our COVID testing infrastructure was led by the scientific workforce. So healthcare science was really the professionals behind Scotland's ability to deliver testing at pace and testing at scale. Using their expert scientific skills, they advised government, but also they worked around the clock to ensure we had appropriate testing capacity within Scotland. But I'm going to sort of share with you, if you don't mind, a few of the other sort of maybe less seen things that our scientific workforce were doing. And our clinical engineers, and I don't know how much you know about clinical engineers, but they're really the backbone, if you like, of hospital services, both in sort of secondary care, but also in primary care as well. They ensure that all of our clinical equipment is appropriately and safely maintained. But during COVID, gosh, those professional groups, they really stood up to the challenge. So our clinical engineers worked advising government on ventilators, but also worked with the UK government in a sort of UK national group, advising on ensuring that Scotland had enough ventilators and enough intensive care equipment, infusion devices, etc. And really they were an absolutely incredible part of our workforce to ensure that we were able to provide the care to patients when we needed it in those really acute phases as well. But it'd be remiss of me not to say that our physiological scientists as well, who are our more patient-facing group, were really challenged during COVID because, of course, we couldn't have patients come into hospital for diagnostic tests in the same way as they did in the past. So they had to think very differently. So they were using their transferable skills to think, how can we deliver care to our patients at home? How can we safely advise patients to self-monitor? But all the time knowing that there was going to be a specialist scientist overseeing that remote care. And I think what we've really grasped now is the legacy of some of those really sort of innovative ways of working. You know, those will not be lost as we go forward. And I think certainly from speaking to scientific colleagues in the NHS, it's how we build upon some of those new ways of working and some of those innovative service delivery models and work with patients to think, well, actually, how do you want us to do your diagnostics? How do you want us to monitor you at home? Do you really want to have to come into a hospital to have all of these things done? So I think it gives us great opportunities building upon something which was really quite devastating for our country.
Oh, thank you, Kathleen, for another great explanation of everything that happened. It's brilliant. I mean, I wish I've heard this when I was at school. I would have been straight to science. I would have followed the science route. You've really inspired me today. So thank you. Thank you for sharing this. Kathleen, please can I ask you, how will you be spending your time at the conference?
So I'm planning to go to as many of the sessions as I possibly can, but I think as well, this is a fantastic opportunity for us all to get together. And we've missed that over the last number of years. And I think that we miss that collaboration and that networking that we get from face-to-face events such as this. So I plan to spend as much of my time as well meeting people and networking and actually trying to sort of sense check how we can work together as we move forward as well. Because, you know, every sort of solution is best whenever we put lots of heads together and give that some great thought. So I think for me, I'm really, really keen to speak to my professions at the conference, as well as obviously seeing how we can collaborate across the different professional groups. So I think there's a lot of excitement in terms of getting in a room together and doing that sort of discussion, collaboration and collective thinking. So yeah, looking forward to seeing people again in real life.
And if you're listening to this conversation, please pass by stand 60 and have a conversation with Kathleen and other colleagues we've been interviewing over the last hours. Just finally, Kathleen, what message would you like to give to colleagues listening to this interview and colleagues across Scotland?
So I think I've just converted you into becoming a healthcare scientist. So if I could do anything, I think it's really to raise the profile of just the fantastic work of scientists within health and social care in Scotland. We've a lot of work to do together to raise the profile of the significant part that they play within sort of the patient journey across the entire patient journey that we've sort of just chatted about there. So I think it's about sort of how we can all work together and how we can really articulate the value of each of our different professional groups and the value of that collaborative working as well in a multidisciplinary team sense to ensure that what we do is for the best of the patients and the public in Scotland.
Oh, thank you so much, Kathleen. Thank you for such a brilliant conversation. And yes, you have inspired me today on the science route. And thanks to everyone for taking the time to listen. Thank you, Kathleen.
Thank you, Tommy. Lovely to talk to you.
As we continue today's NHS Scotland Alliance Live special, I'd like to welcome our next guest, Anne Armstrong, Scotland's Deputy Chief Nursing Officer. Welcome, Anne, and thank you for taking the time to join us. Please, can I start by asking how you're doing today?
I'm good, Tommy. I'm really enjoying thinking about being at this conference and getting out and about. So I'm delighted and great. Feeling great to be here. Hopefully you are too.
No, absolutely, and really looking forward to our conversation today. And please, for myself and for people listening and visiting the conference, can you tell us a little bit more about your role in Scottish Government as a Deputy Chief Nursing Officer, and what does this mean?
Thanks, Tommy. Well, I started in this role in July, so I keep telling everybody I'm still new. And I'm claiming that at least I'm a year in post. I'm still new and still very much learning and listening to what people are saying about what's needed in services. I've worked in the NHS for many years, and I'm now getting a much more stronger connection with the care home sector, which I am delighted about. So very much a broad portfolio. Key things that I would be involved in is leading on excellence in care, providing advice to Scottish Government on a whole range of issues, thinking through about how do we develop the workforce to enable remobilisation to happen in the NHS, for example, integration, that joined up approach to care, and leading with some work on the care homes and community nursing. So in essence, it's about collaborating with people right across the country with a view to setting the conditions that enables great care to be delivered, regardless of where you are. So exciting times, and I would absolutely recommend the post for any aspiring Deputy Chief Nursing Officers coming forward in the future.
Oh, lovely, and it sounds like a really exciting and wide-ranging portfolio and piece of work. So thank you for that, and for sharing a bit more about the role. So we're here today at the NHS Scotland Conference here in Aberdeen. Can you tell us how your colleagues will be engaging here during the event?
I can. As you know, nurses are the largest group of clinicians right across the NHS, and they also work in social care. So there's not much happens without my frontline nursing colleagues right across the country. Many of them are here, and some are presenting, and many are engaging in the various sessions right across the next couple of days. And they'll be reflecting and thinking through what does that mean for them in practice, and how do they utilise the learning from the next couple of days to really improve care in their area and across the country.
Oh, lovely. And it's a great opportunity to reconnect, isn't it? And share practice, share stories, and get to reconnect again. So, Anne, the pandemic has been pretty challenging to health and social care over the last couple of years. What are the challenges and the opportunities that lie ahead for nursing colleagues in Scotland?
You're absolutely right, Tommy. It has been really challenging the last couple of years, right across, whether it's health or social care. Lots and lots of challenges. The couple I think that we really need to focus in on, of course, is remobilising. So catching up on all those interventions that's not been done for the last couple of years. And of course, many people have held back going to their GP and others. So quite often they're more complex when they do arrive at us. And of course, we have a very exhausted workforce. I've included my nursing colleagues in that. They're absolutely exhausted. So we need to think about how we support them to continue to provide the great care they have provided throughout COVID and before that, actually. Opportunities, I think there's many opportunities going forward. So as you know, technology and digital came through quite a lot during COVID. Near me, and different approaches to digital were fantastic. So I think we can build on that. There's opportunities just to link up more primary care, secondary care together around multidisciplinary teams. Of course, nurses will be absolutely up the middle of that and advancing their practice, whether that be in digital or whether it be in a range of clinical interventions and assessments. I think the other bit for me is about integration. How do we work even more closely together? And of course, the NCS in the next few years will start to develop that even further for us. And again, nurses have a huge role to play in that space. And the last thing I would say is around mental health and well-being. Yeah. I think one of the opportunities that the pandemic allowed us was that for it to be okay to be not okay, for people to be able to say how they were feeling emotionally and mentally. It was quite often, you know, people don't want to say how they feel, they put on a brave face. And I think the public, our clinicians, and I include nurses, midwives, CHPs, healthcare scientists and medical staff, are more able and more likely to feel that they can say about how they genuinely feel. And certainly we'll develop much more in the way of self-help tools and specialist services to help them around mental health and well-being. And I think there's a real opportunity to build on that and for it to be okay to continue to talk about how you feel, both physically, mentally and emotionally. We can't let that go. We need to build on it. So we absolutely look at each person holistically, their physical and mental health needs as we go forward.
Well, thank you. That's a really important message. You know, personally, as a son, I cared for my mum at home for nearly 6 years. And actually, you know, when I look back at it, I think I wish I'd have been more kind to me during that time. I think somebody asked me after that, what's the first message you would like to give to people? That, and it was, it's okay to ask for help. And I wish, so I'm really glad that that's a strong message that about caring, because I mean, my goodness, Anne, where would we be without you and all your colleagues? You know, where would we be without you? So I'm really glad that's a strong message in there. So thank you, Anne.
Absolutely. You've got to be okay to enable you to help others.
Yeah.
So it's really important that you take the time to look after yourself and be the best version of you to enable you to provide the best care.
Lovely. I'm really glad to hear that message today from leadership. So thank you for that, Anne. And can you tell me a little bit about how you will be spending your time at the conference?
Well, I am absolutely delighted, Tommy, to be getting out and about and seeing people. I love speaking to my colleagues and listening and learning from them. So I've got a number of sessions I'm going to be listening into. I am really keen to chat to my frontline colleagues in particular, whether that be the background from healthcare or social care, to understand what works, what doesn't work, because it then helps when I'm thinking about national policy or national work, so that I think that through when we're looking to put a range of policies or approaches or guidelines in place, to have that real life experience and examples, so that I do my best work. So that's what I'm going to be doing. And of course, I'll be helping to man the stall, the CNOD stall as well. So looking forward to chatting to people and listening and learning.
Oh, thanks, Anne. And that was a big call out. If you're at the conference, please visit Stand 60 and have a conversation with Anne and colleagues at the conference. A great opportunity to go and ask some questions and share some stories. And as we come to the final question, what message would you like to give to colleagues who are listening to this interview and your nursing colleagues across Scotland?
I would like to say thank you first and foremost for the last 2 years, but actually before that, Tommy, because the work that they do is phenomenal. You can't underestimate that, and I'm absolutely in awe, particularly of my frontline colleagues. I think they have really been magical in their approach. So I would like to say thank you. I would like to say how important it is to take the time to look after you and be your best self to enable you to provide the best care possible. And I look forward to catching up with you. Please come and see me in Stand 60.
Oh, thank you. What a lovely end to the conversation. And thank you for such a brilliant conversation today. Thank you for taking time to join us. Our next guest today will be Justine Craig, Scotland's Chief Midwifery Officer. But once again, Anne, thank you so much for your time today. And I look forward to seeing you over the couple of days. Thank you very much.
Thank you.
As we continue our NHS Scotland Alliance Live special, I'd like to welcome our next guest, Carolyn McDonald, Scotland's Chief Allied Health Professions Officer. Hi, Carolyn. Welcome and thank you for taking time to join us today. Can I start by asking how you are?
I'm fine, Tommy. I'm looking forward to our conversation. We've done this before for National AHP's Day, but it's really nice to see you again. Delighted to have a conversation with you.
Absolutely, and it's lovely to continue the conversation on from AHP Day. Hey, Carolyn, please can you start by telling us a little bit more about your role in Scottish Government as Chief Allied Health Professions Officer, and what does this mean?
So I came into Scottish Government in January 2020 as the most senior professional advisor for allied health professions. And I provide expert advice to Scottish ministers, to the Director General for Health and Social Care, to the Chief Nursing Officer, Chief Medical Officer, and to the various directorates on all aspects of Scottish Government policy and which impact on AHP education, practice, research, and workforce. I work with senior policy colleagues to set the strategic direction for the allied health professions in Scotland and to agree on programmes of work across Scottish Government which enable progress to be monitored and evaluated to ensure that the AHP contribution to wider policy is maximised. I also provide leadership in Scotland to our 14 different professional groups, and I have very strong links with all of the health boards, with the health and social care partnerships, with our professional bodies, with the academic institutions, and who train our probably 4,000 or so allied health professions of the future. I also work very closely with my other Chief Allied Health Profession colleagues across the UK. So it's a hugely varied job and one that I'm very privileged and humbled to hold, Tommy.
Oh, thank you for that brilliant overview of this massive piece of work that you're overseeing. So thank you for that, Carolyn. So we're here at the NHS Scotland Conference in Aberdeen. Can you tell us a bit about how your colleagues are engaging here during this event?
So it's hugely exciting to be in Aberdeen this time for the conference, since we've had it in the Central Belt for so long, and I'm delighted that I can attend in person myself. So with regard to the allied health profession, some are presenting at sessions, so parallel sessions and spotlight sessions. I myself, with some other AHP colleagues and indeed third sector colleagues, including the Alliance and Leisure Trusts, are leading a session on rehabilitation called Integrated, Innovative and Ambitious Rehabilitation in a Post-COVID Era. So that's what I'll be getting up to. That session's running over both days, so I'll be busy at that. And I'll be busy, attending other sessions myself when time allows. The exhibition at the NHS Scotland Conference is always fantastic, and the Chief Nursing Officers Directorate, of which allied health professions, healthcare science, midwifery and nurses are all part of within Scottish Government, has a stand, as you said, stand 60. And we will be, at that stand to meet and greet and say hello to our colleagues who want to find out what we're doing in government. Our professional bodies also have a stand. So some of our professional bodies will have a stand, and I think Robert Gordon University also has a stand. So I'll be busy. It's a hugely busy 2 days. For the first time ever, there are experience days the day before the conference, so I'm attending one of those. And I'm also going to be visiting Robert Gordon University on the evening of the first day of the conference in the evening. Robert Gordon University trains a whole section of our workforce, and they're putting on a really exciting evening event. And I would encourage delegates from across our professional groups whose future workforce are going to be trained in Robert Gordon University to go along to that. So a very busy and exhausting couple of days ahead, Tommy.
So that's brilliant. As well as having the conference in Aberdeen, you're expanding out to go and visit the universities. That's fantastic. And I'll continue. You're welcome to pop in to stand 60 and say hello to Carolyn and colleagues, if I'm allowed to do that. But yes. Please pop in to stand 60 and have a conversation with Carolyn and colleagues. Carolyn, the pandemic has been pretty challenging to health and social care over the last couple of years. What are the challenges and opportunities that lie ahead for the allied health professions workforce?
So I think by our very nature, allied health professions are creative, they're innovative, they're visionary. And you only need to look at some of what they got up to over the pandemic in terms of embracing technology, delivering new models of care, being redeployed into other areas when they couldn't have patients into clinics, etc. So no matter what's thrown in our way, I think allied health professions thrive. So whilst I recognise there are now obstacles in the road in terms of recovery and rejuvenation following the pandemic, I firmly believe that allied health professions will embrace these opportunities that present themselves. The recovery of health and social care services, the impact of COVID and long COVID, the need for rehabilitation, the move towards the National Care Service, all present us with the challenge to put ourselves forward and take leadership in showing just what we can offer across our professional groups. I think one of the challenges that might present itself is the demand for our services and the capacity we have. But I'm leading on an AHP education and workforce review in Scottish Government at the moment. And I think that will go some way in addressing some of the challenges that we have as a workforce in terms of ensuring that our education and the ways that we educate our AHPs, and indeed how many AHPs we need, will be addressed through the AHP Education and Workforce Review. So yeah, challenging, absolutely, but I think the AHPs will definitely embrace that.
Lovely. You know, I have a special place in my heart for AHPs, for a speech and language therapist who came and sat with my mum one evening when we were quite scared and I was unsure what to do. So always a special place in my heart for you and all your colleagues.
Oh, thanks, Tommy. Thank you.
Can you tell me a little bit about how you'll be spending your day at the conference?
So I will be presenting at the parallel sessions, but I love going to the sessions myself in the conference. So I'll be going to some of the plenary sessions and also some of the spotlight sessions. There is some lunchtime sessions, which I hope to get into as well. I'll definitely go to the evening session at Robert Gordon University. This is really important for us and for our key stakeholders across Scottish Government, across boards and partnerships who employ allied health professions, and also our professional bodies, to go into the university and see the fantastic facilities they have at Robert Gordon University in terms of what it offers to students who go to that particular academic institution to train. So I'll definitely be going to that. And as I say, I know that the few days will fly in. It's a fantastic opportunity at last for us to go out and meet people in person. So I look forward to that and just connecting and reconnecting with colleagues that I haven't seen for quite some time.
It's a very busy few days for you in Aberdeen. Carolyn, please, what message would you like to give to colleagues listening to this interview and across Scotland?
So I guess firstly, enjoy the conference. If it's your first time going to the conference, I think you really will enjoy it and love connecting with new colleagues, and you'll maybe see some colleagues that you haven't seen for a while. So first of all, enjoy it and do your very best to attend as much as you can, because there's so much crammed into the few days. So I think that would be my first message. I think secondly, Tommy, a huge thank you to all allied health professions, because even in the darkest days of the pandemic, AHPs embraced new challenges. They rallied with each other's and other parts of the workforce, you know, in terms of nursing, in terms of medicine, other partner organisations, to rally with each other for the benefit of the people of Scotland. So a huge thank you. The work of the allied health professions continues to make such a difference to people's lives as we recover into a new phase. I think a shout out to our students, and a huge thank you to students for their understanding and their maturity and their patience over the last couple of years, because they've successfully navigated their way through disrupted education programs. And that's hugely important, to thank the students for that. And hopefully as we recover, their education programs and their placement experiences will recover. So exciting times ahead. Enjoy the conference, and just hugely looking forward to connecting with allied health professions and other colleagues over the coming days.
Well, thank you, Carolyn, for such a brilliant conversation, and thank you for such a lovely message to end on today. So thank you so much for joining us today, Carolyn. Continuing today's Alliance Live NHS Scotland special, I'd like to welcome our next guest, Justine Craig, Scotland's Chief Midwifery Officer. Hi, Justine, welcome, and thank you for taking the time to join us today. Can I start by asking how you're doing today?
Yes, I'm very well, and thanks very much for having me here today. It's really good to be here and to be able to attend the conference as well. So really exciting.
Please, can you start by explaining to us a bit more about your role in the Scottish Government as Chief Midwifery Officer, and what does this mean?
Yeah, so I'm happy to do that. So I just started my role in January, and so it's been a very quick 6 months, I have to say. So I think I'm learning it myself, but my role is around expert professional and clinical advice to ministers and to my policy colleagues. I work across the Chief Nursing Officer Directorate and the Directorate of Children and Families. Although my title is Chief Midwifery Officer, I also have community children's services in my portfolio as well, which is really exciting. So I'm able to influence policy areas, and I work across a broad range of policies, all to do with women's health, pregnancy, birth, infant feeding, old maternity services, health visiting, family nurse partnership, and school nursing. So quite a broad brush, but all, as you'll understand, completely interconnected. And really, it's about trying to ensure that women, children, and families have the best sort of start in life, and that we improve outcomes for all our families. So I work very closely with NHS NHS Education Scotland and his health, and we've got a couple of joint discussions on the go, looking at midwifery workforce, the midwifery career framework, looking at relaunching the Best Start strategy for maternity and neonatal services in Scotland. I work very closely with my heads of midwifery colleagues, and I'm hoping to get out and about around and visit areas very soon. I think I'm starting that at the end of this month, so that would be great. And I also work with the university providers and the higher education institutes, and work across the UK as well. So link very closely with the Royal College of Midwives, the Nursing and Midwifery Council, and my CMIDO, as we call ourselves, colleagues across the 4 countries. So yeah, so just finding it myself, but yeah, yes, it's very interesting and a real privilege actually to be able to be doing it.
Thank you for that brilliant overview of such a wide-ranging portfolio, and that's really helpful for myself, I'm sure for others, to build a little picture of all the areas that you work across. So thank you so much for that. So the pandemic has been pretty challenging to health and social care over the last couple of years. What are the challenges and opportunities that lie ahead for your colleagues in Scotland?
Well, I think the main, probably one of the main challenges really is recovery. So for my areas of sort of professional expertise and interested in my portfolio, really there was a minimal amount that was stopped during the pandemic. So for example, maternity services have to keep going, neonatal services keep going, health visiting, really important that these services kept going during the pandemic. So there wasn't any sort of step down, and I suppose we're looking at how that has affected people, and that includes colleagues and services. People are fatigued, so we really need to be looking at the sort of well-being and trying to get some impetus back and positivity around sort of remobilizing and coming through the next stage of the pandemic, because of course it's not over. So I think that's really challenging. I think we've learned a lot. We've learned a lot about women and what they need during their pregnancy and childbirth, because of course it's been really challenging when no visitors were able to be with women even when they were ultrasound scans. In reference to women's health, there's people that have been waiting for some time to be seen around women's health issues, so there's that. and also with regard to children's development and the pressure that it's put on families. You know, there's real work to do there around the early years and health visiting. So quite a lot. I think there's a lot that we've learnt, and a lot that, you know, if something does happen again, that we would be, you know, considering and sort of reflecting on how we've done at each phase of the pandemic as we're coming through it. So yeah.
Thank you, Justine. So we're here in Aberdeen at the conference. Can you tell me how you'll be spending your time over the couple of days at the conference?
Yes, so it's been many years since I've been to the conference. The last time I was in Glasgow, so I'm really looking forward to joining the breakout sessions and to go to the events. I think there's quite a lot of information around digitalisation and also around remobilisation. So I'm really looking forward to linking into that, and also seeing things that I wouldn't normally see in my sort of area. So I always find that the presentations and the stalls are very interesting. A lot of cross learning, I think. So understanding what other specialties and areas are doing and where we can link in together, and really meeting people face to face, of course, would be very nice. And just to be at a conference is very nice indeed. So yes, I think that's good. It's exciting to be able to do this again.
And you'll be part of the CNO Directorate stand number 60 at the conference, and I'm sure people can pop down and say hello to yourself and some colleagues while they're there as well.
Yes, yeah, it'd be great to see people, because I will be at the stand and around, so it'd be lovely to catch up with people and meet new people.
Thank you. And just finally, Justine, what message would you like to give to your colleagues across Scotland today and to people listening to this interview? I suppose it's a personal message. So I think let's try and be, it's great to be here, great to have a celebration of the NHS. So it's fabulous to be at the conference. And I suppose it's something a bit about drawing a line and seeing where we're moving forward to now, and how we can really move forward with together with well-being and staff and the people that we look after and care for at the core of that, coming out of this really difficult period and looking for some optimism moving forward. Oh, lovely. Thank you for such a lovely message to end today's conversation. Thank you so much, Justine, for joining us today. And thanks to everyone for taking the time to listen. And I hope you have a great couple of days at the conference. Thank you very much.
Thank you very much. Thank you.
So that concludes our NHS Scotland Conference Alliance Live special. And I would just like to extend my great thanks to everyone who took part today. With great thanks to Alex McMahon, Catherine Ross, Carolyn McDonald, Anne Armstrong and Justine Craig. I really enjoyed our conversations, and I'm sure everyone listening did as well. There are so many fantastic sessions taking part across the conference over these couple of days. So please make sure you get involved, make the most of the shared learning available from colleagues during your time in Aberdeen. Our Alliance Live guests from today, the Chief Nursing Officer Directorate, will be located at stand 60. So please come along, say hello and have a conversation. Thank you once again for listening, and thank you for all that you do. Thank you.